I'm Giri. I'm an interventional cardiologist at the University of Pennsylvania in Philadelphia. And we are here today with Vikas Aggarwal, joining me from Michigan, interventional cardiologist there, to discuss a novel therapy to treat chronic thromboembolic pulmonary hypertension called balloon pulmonary angioplasty. This is really exciting, but it's not all sunshine and roses, right? Because it is an endovascular procedure. We're doing something pretty novel. We're in the lungs. And it's not always the most forgiving circulation as two of us do these procedures. So why don't you talk about what there is to worry about when you're taking on these procedures?
It's an exciting therapy, but it's also fraught with risks. The learning curve has traditionally been pretty steep because in the lung, you are essentially trying to work around a bunch of air balloons. In my mind, the most unforgiving circulation or vascular bed in the human body. You have to be careful. You have to know your anatomy. You have to know your branches and your blood vessels and where to go and where to not go. And that's exactly the impetus or the reason for a document like this from the American Heart Association. We don't want essentially everybody who wants to start this to go through the same steep learning curve that some of us have already gone through. We want to help people start these programs safely and successfully at their institutions. And a document like this will help you understand anatomy, technical details, as well as your procedural goals and post-procedural follow-up. The complication rates have come down substantially over the past 10 years, which is promising, and which shows that it can be done safely. But we want everybody to use this document and to use the resources that exist to take this field even further forward.
The specific things that we run into from a complication standpoint include issues related to pulmonary hemorrhage, and it usually presents with hemoptysis. And obviously that can vary in terms of its severity, but it's important that folks recognize how to perform the procedures to minimize that risk, A, and then B, if, God forbid, despite those efforts, the complication emerges, how do you manage it? So that is some of the topics that are covered in the document that you led.